All right, I think we're ready to get started. Hello, everyone, and welcome to Exploring the Refresh Public Health Improvement Resource Center webinar. My name is Michaela Kershey. I am the Project Manager for Performance Management and Quality Improvement here at the Public Health Foundation, and we are just thrilled to be welcoming you today to be sharing the new Public Health Improvement Resource Center with you. I also have on the line my colleague, Julie Sharp, who will be helping to lead the webinar today. Julie, I'll give you a bit of more background about her in a moment, but Julie has been really pioneering the refresh and the updates to this repository, to this database of information and resources, and we're thrilled to have her on the line today. Before we get started, just a few housekeeping items. First of all, lines will be muted for all participants until the end of the webinar. At that point, we'll be unmuting the lines so that folks can ask questions. Please, we will remind you, but please, once we do unmute the lines, please manually re-mute your line if you're not planning to ask a question. This will help to cut down on background noise and make the webinar a bit more pleasant for everyone. I also want everyone to know that the webinar is being recorded, and we will be posting the webinar on Train, which is PHAB's Learning Management Network. So I think that's it for right now. If you have any questions or having any issues, you'll notice in the bottom right corner of your screen there's a chat box. Feel free to write any of your questions there, and we'll try to get back to them just as soon as we can. So without further ado, I'd like to get started. First, I'll introduce my colleague, Julie Sharp. Julie is a QI consultant for PHF. She was responsible for revising the content of the Public Health Improvement Resource Center this year, and prior to coming to us, she spent over 13 years at the local health department in Kane County, Illinois. During her tenure there, she coordinated the department's successful application for PHAB accreditation, while taking primary responsibility for the development, implementation, and evaluation of the department's quality improvement and performance management programs. Prior to that role, Julie worked for several years coordinating programs within the area of maternal and child health, including quality assurance, quality improvement, and auditing within the division. So we're thrilled to have you here. Julie, do you want to just say hello?
Hi, everybody. Thanks for joining us today.
Great. So the two of us will be shepherding everyone through this exploration of the Public Health Improvement Resource Center. Let's get going. So first of all, a bit about PHF, who we are. We are here to improve the public's health by strengthening the quality and performance of public health practice, and we do that by focusing on sort of three pillars of public health infrastructure. One, quality improvement. Two is performance management, and three is workforce development. You'll get to hear a bit more about the Public Health Foundation towards the end of the webinar, but really the Public Health Improvement Resource Center sort of brings all those pieces together and is a really a nice way for us to try to help folks like you do what you do, which is sort of this shared goal of improving the public's health. So we do have some learning objectives for you today. In addition to what you see up here on the screen, we have sort of in caps and bold letters at the bottom of the page that this resource belongs to you. One of our other sort of learning objectives, is perhaps a little less formalized, but is that we really want folks to feel as though they have some ownership of this database, of this resource, because as time goes on, it will be growing, and we want to make sure that you all have some input as to how it grows to meet your needs and to make sure that we're developing resources and a website that is really going to be useful to
on the newest version of the PHAB Standards and Measures, version 1.5. The 10 essential services, community health information and data systems to track and manage large sets of data, performance management, finance, workforce development, and then the newest category, which shows where the results of public health and healthcare intersect. So finding the Public Health Improvement Resource Center is easy. As part of the Public Health Foundation website, the web address is www.phf.org/improvement. So let's take a look now at the Public Health Improvement Resource Center website. Here's what you're going to find when you go to that main page. The blue area is an area, the blue arrow is an area where you're going to see any announcements, any updates. For example, a recent update now allows you to browse and filter results based on the PHAB Standards and Measures from version 1.5. You can now also filter by the category Public Health and Healthcare. The orange arrow points out the quick search function, which allows you to type in a few keywords and get searches right away. However, below that, you can click on Advanced Search for additional search options. We're going to look at that in a little more detail in just a moment. And remember, this site is only going to continue to be the great site that it is if the public health community continues to update the site with new and interesting resources. You can always submit additional resources and suggest improvements by clicking on the link that's indicated by the green arrow that says Suggest a Resource, comment, email us. The main page of the site also will list the newest resources added to the Public Health Improvement Resource Center, the most popular resources, and the top keyword searches. So when you send us the new resources, they're going to appear here after they are added. So when you click on the advanced search from the main page, you come to this page. As you can see, you can filter your search by in a number of different ways. You can obviously start by searching by keyword. If you want to find documents that include the phrase quality improvement, you can type that right in the keyword box. The results will list not only resources with quality improvement in the title, but if the resource has also been tagged with that phrase, or if the description includes the word quality improvement, they will come up in the results as well. You can change the search so that it only looks at titles by clicking in the bubble marked title only. The drop-down box titled Resource Format allows you to filter resources by their type. As you can see, you can search just by case examples, publications, and web resources, among others. The default is to search by all types of formats. So if you want to narrow down, you would check the boxes to unclick. With regard to cost, not all of the resources in the Public Health Improvement Resource Center are free. The majority of them are available without cost, but there are some resources like journal articles that require payment in order to access them. We felt that they were good to include, but just know that you may have to incur that cost if you decide to view them. There aren't a large number of those. We want the community to be able to easily access what they need, but you can filter out any that have a cost by clicking on free will only bring up the ones that are free. As we mentioned at the beginning of the presentation, you can search and filter your managing large sets of data or data repositories, performance management systems, Public Health Performance Standards program. Also, because a bank of resources is really only as good as your ability to find them, we have a plan to improve functionality of the search feature to allow for a more specific and targeted search. So even more searchability than there is right now. Finally, the Public Health Foundation is going to be collaborating with some partners, such as the Public Health Accreditation Board. We're going to identify additional resources that we want to add to the Public Health Improvement Resource Center. In doing so, we want our partners to then identify health departments who are doing new and innovative work so that those resources can be shared on the site. We know health departments do great work, but this is the opportunity to share it in a broad way. So now, we want all of you to take a minute, if you haven't already been doing so in the background, to visit the Public Health Improvement Resource Center. The URL is on the page, so www.phab.org/improvement, and explore for a couple of minutes. Try to search, click on some of the new resources. After that, we want to hear back from all of you. We have some questions for you about how we can continue to develop this site. So we'll go ahead and give you a couple of minutes, and then I think Michaela will be taking over after that.
So we'll give you about another 60 seconds or so to perhaps conduct a search of your own, look through some of the categories, perhaps check out the latest resources. And we'd love to hear your feedback and your questions. As a reminder, there will be time for questions at the end of the webinar, so you can either type them into the chat box or hold on to them until that time. All right. So hopefully everyone is well on their way to completing a successful search. While you're finishing up, let's talk a little bit. I promised at the beginning of the webinar that I would tell you a little more about the Public Health Foundation and a little about what we're up to. The three pillars of public health that we're interested in are quality improvement, performance management, and workforce development, as I mentioned. And we focus on those areas through a bunch of different programs. A few that you may know about. One is TRAIN, our learning management network. And it looks like the slide, there's a little bit of writing over the description, but it's the nation's premier learning management network for professionals, helping to protect the public's health. And you know, these numbers are updated, it seems like weekly, but the most current information I have is over 850 registered learners and 29,000 courses. It's quite possible that that's old information and that by this point we even have 1 million registered learners. It's just hugely popular and has courses about an incredibly wide range of topics related to public health. So it is free to everyone and it's easy to set up your own account. So I encourage everyone to check that out. Also, we have the academic practice linkages program here, which is furthering academic practice collaboration to assure well-trained, competent workforce and strong evidence-based public health infrastructure. Our fearless leader, Ron Bialik, heads that up, and it's ever growing and a really great opportunity for those in the field to find collaboration between academics and practice-oriented folks in public health. Our Learning Resource Center, where public health, healthcare, and allied health professionals can find high-quality training materials at an affordable price. There's tons of really great materials in the LRC, as we call it here, and I encourage everyone to check that out if you're looking for something to bring back to your community or to your organization. That's a sort of an educational tool, kind of that you can touch, something that that's a book or a handout or something of that nature. There's just a host of options available on the LRC. And then lastly, PHF, we provide technical assistance and training, and there's a wealth of different possibilities there in terms of how we can assist you with your quality improvement, performance management, workforce development needs. So with that, here are questions for you. Julie, you want to take over here and field some of these questions?
Absolutely. So we've said throughout this webinar that this is a resource for you to support your work. So here are our questions for you. We realize that for some of you, the Public Health Improvement Resource Center may be new. Some of you may have been visiting us for a while. So I believe we're going to unmute lines. And remember, if you're not speaking, to please mute your line. That would be great. So while we are doing that,
all guests have been unmuted. You will now rejoin the meeting.
We'd like to know first, what would you like to see more of? So I've seen Christine's comments about health equity. What else would you guys like to see more of in this database? We can also be thinking about if there are categories that would be helpful for narrowing down searches.
I'd also like to say this is an open-ended question in terms of time frame. If you need a little more time to check out the website and let us know at a later date. The door is certainly always open, but we would love to hear if anyone has thoughts. Now, Sonia is writing that there's so much on the site. So maybe there's so much there. Maybe folks just need a little while longer to kind of survey and sift through everything to figure out what may be missing.
Yeah, and that's fair enough. We can definitely give you time. We're always looking for ways to make this a better and more functional site. So please use that email address, phf_resources@phf.org. We're going to give you Michaela's contact information in just a minute, so please feel free to continue. We've got people giving us feedback, so we'll just kind of see how things go.
Julie, I also looked at your last question there about functionality. I think is an important one as well. In addition to adding new resources, we are interested in functionality. Are there particular methods for searching that not able to conduct on the Public Health Improvement Resource Center right now that would be useful to you? If you tell us, oh, I wish I could search filtering, in this particular way. Maybe you'd like to see subcategories. Maybe you'd like to see broader categories. Whatever it is, again, just to reinforce that we're all ears and really interested in improving the site, and there all feedback is welcome. It doesn't just have to be about the resources themselves.
Absolutely. So we've got some notes and things coming in. Sonia's got a comment that there are some materials that she wasn't aware of, didn't know existed, and I agree. As a former practitioner, I wish I would have known about a lot of these previously myself. So we've got to get the word out. You all that are here, spread the word, share this as a resource to people. And Sonia has suggested to be sharing it with programs, with MPH and public health science programs. I think you an opportunity to ask any questions. I see some more things coming in, and that's great. Remember, contact us if you think of things after. You know, sometimes I'll get off a webinar and go, oh, I wish I would have thought of that sooner. Here's Michaela's contact information. You've also got the other email address. But comments, questions, feedback. Michaela's happy to answer questions. I'm happy to answer questions. She can get things to me as well. PHF_resources at phf.org for new resources. We hope to continue to grow this resource for the community, but we definitely need the community to, keep us current. What innovative things are happening in the field? What are you using to do your daily work? Even if you don't think that it's new and innovative, somebody else might. So feel free to share. So any questions from the group now?
Julie, we have a couple of questions coming in. They're being back channeled, so I think I'll share them with the group, folks who are writing to us privately. One of the questions is about this new public health and healthcare category. Folks are wondering what they can find in that category, and while I encourage everyone to check it out for themselves to see what's in there, what you'll find is everything from brief stories about ways that community partners in public health and healthcare are collaborating to address a common population health challenge, to examples of a population health driver diagram, which is a framework that can be used to help those in public health, healthcare, community partners collaborate to address a particular challenge. You'll see all kinds of resources like that, and that's an area again where the material is just really multiplying every week. So I think you can expect that particular category to expand pretty quickly over the next several months. We received another question here. How does the Public Health Improvement Resource Center relate to performance management? Someone here asked about the performance management toolkit that PHF has. It's a great question. One of the things that we've talked about a lot is really making sure that we know that there are a lot of resources out there, making sure that there aren't too many go-to spots for information. The performance management toolkit that the Public Health Foundation provides is really focused on performance management and creating a performance management system within health departments and organizations. And the Public Health Improvement Resource Center is sort of a broader place to go. The performance management toolkit, again, because it's a bit more specific, it doesn't have quite the same database structure where you can search resources and try to identify just the resource that you're looking for in the same way that you can in the Public Health Improvement Resource Center. So those are a couple of changes. You may see that there are some overlap in the resources, but for the most part, I'd say that that the Public Health Improvement Resource Center is a bit broader and captures really anything having to do with performance improvement, and is sort of meant to be more of a searchable database. So any other questions? I love the conversations happening in the chat box. That's really great, and good suggestions. I do see a question here. Why would I go to this site versus, say, NACHO, branding as formal QI versus examples of good ideas you can try? Seems to be important, and so thanks for bringing that up. As I sort of just said there, we know that you have a lot of different places that you can visit to look for resources. What we've tried to do here is to really include the resources in a manner that helps folks to just pinpoint what they're looking for, that is quite searchable, that is organized very well by categories. And we do work closely with our partners at ASTO and NACHO and a lot of the other organizations to make sure that we're not duplicating efforts. So hopefully this meets a different need and provides a different strategy for searching. And I do like the comment about formal QI versus examples of good ideas you can try. Any other questions? All right. Well, thank you all so much for joining us. This was really a treat to be able to talk to everyone, to share this new and improved, really just or improved than new Public Health Improvement Resource Center. We look forward to continuing to meet the needs of the field and meet the needs that we're hearing about from all of you to make your jobs a little easier and to help you be successful in the important work that you do. So please don't be a stranger. Reach out to us. Let us know what's working. Let us know where you see room for improvement and how we can be helpful. So thank you very much, and have a great afternoon.